Hi, my name is Josh Chen, and today I'd like to demonstrate how to perform the two-handed tie. I'll be demonstrating a right-handed tie first and a left-handed tie after. All the materials you need is your tying material. In this case, I'll be using this pink shoelace, and I'll be tying around my leg. This way, it's easier to see how the knot is being laid down. The first step is to loop the shoelace under the structure you'll be tying and across the ends. I'll be performing a right-handed tie first, so the right hand will hold the suture in front. If you're performing a left-handed tie, the left hand will hold the suture in front. Next, you want to grasp the two ends of the suture in a finger gun's hold. You'll want to grab the ends of the sutures with your third, fourth, and fifth digits and looping the proximal end of the shoelace over your extended pointer finger. Once you have the finger gun's hold, you want to take the suture in your left hand and bring it into the crook of your thumb and pointer finger on your right hand, forming a loop with those fingers, rotating the loop under the suture held by your right hand, grabbing the free end of the suture from your left hand, rotating back under, and handing yourself the suture end. You can then guide down your knot with your right hand pointer finger. The knot should lay down flat. For the next knot, you want to have your finger guns ready again, except this time, the proximal ends will loop over your thumb. Same as the first time, your left hand end will be brought into the crook of your right-handed thumb and pointer finger. Fingers will pinch, rotate under the suture held by your right hand, grabbing the free end, rotating back, and handing it to yourself. Then you want to take your right arm and cross over to lay down the square knot. And that is how we perform the right-handed square knot. For the left-handed tie, the steps are exactly the same, except the right-handed suture is in front when you cross. Finger guns again, and your right hand will bring the free end into the crook of your left-handed thumb and pointer finger. Your thumb and pointer finger will close, rotate under, grabbing the free end, rotating it back, and laying down that knot. Now for reverse finger guns, the right hand is going to bring the free end over into the crook, rotating under, back, and the left hand will cross over in front to lay down the square knot. It will be valuable to learn the two-handed tie both right-handed and left-handed, as the throwing hand, or the hand that forms the loop with your fingers and rotates, will be holding the needle, which should never flip. To demonstrate, I'll be tying a knot at the end of this suture to represent a needle. I'll be performing a left-handed two-handed tie. I'll be holding the needle in my left hand if I'm performing a left-handed two-handed tie, because the needle should never flip. The suture belongs in the front, the left-handed suture. The right hand will bring the free end over, rotating under and back, laying down the first knot, reverse finger guns, tying the suture, and the needle has never flipped. In the operating room, you'll be performing 4 to 5 square knots in succession. I'd now like to demonstrate the surgeon's knot. The surgeon's knot involves 2 throws instead of only 1 throw for your first square knot. To demonstrate, I'll be doing a right-handed two-handed tie, crossing the ends over your suture, finger guns, performing the first step of the two-handed tie, rotating under and bringing the free end back to yourself. Except before you lay down the knot, you want to bring the suture around one more time. That's called throwing. And with the 2 throws, then you can lay down the first portion of your square knot. Then you proceed as normally, reverse finger guns, bringing that suture end over, crossing with the right hand over, and that's how you perform the surgeon's knot. This has been the two-handed tie. Now I'd like to demonstrate simple suturing and the instrument tie. The instrument tie is useful in cases where you would like to conserve suture. I would like to start by demonstrating how to properly hold your surgical instruments. Here I have my needle driver and Adson pickup, or tooth forceps. For the needle driver, the thumb and the ring finger belong in the rings, and avoid putting your middle finger in the ring. The middle finger should wrap around, and the pointer finger should rest near the nose of the needle driver. This is for stability. Our needle driver also has locking teeth. That will prevent the suture needle from dropping. To unlock the surgical instrument, press in and up with your thumb, your right-handed thumb, and open the jaws of the needle driver. Surgical instruments tend to be right-handed, so to unlock with your left hand, you'll need to push up and out with your ring finger. Your forceps should be held like a pencil in your non-suturing hand. The instrument tie is a parallel to the two-handed tie, but except we'll be using our instruments. To begin the instrument tie, we'll have to complete our first bite. Load the suture needle at 90 degrees to the needle driver, grabbing the needle 2/3 of the way back. Once the needle is loaded, take the first bite by entering the skin at a 90-degree angle, supinating your arm to follow the curve of the needle through the skin. Once you see the needle exit, grab the tip of the needle with your needle driver and continue to follow the curve of the needle to avoid excessive skin trauma. Pull the suture through with approximately 2 to 3 centimeters of suture for the short tail. It is important that your short tail isn't too long or too short. Place your needle driver between the two ends of the suture. Grab the long tail with your hand and perform 2 throws around the nose of the needle driver. This is our parallel to the surgeon's knot. Then, grab the tip of the short tail with your needle driver and pull each end of the suture to opposite directions. Next, place your needle driver between the two ends again, grabbing the long tail and performing a single throw, grabbing the tip of the short tail, and pulling again to opposite sides. Continue to alternate with single throws. And that is how you perform the instrument type. I would now like to demonstrate the deep dermal suture and running subcuticular suture. The running subcuticular suture is useful for closing long incisions, such as fan and steel incisions, and have great cosmetic outcomes. We'll first begin with the deep dermal suture. The deep dermal suture follows the mantra of deep to superficial, then superficial to deep. First, load your needle driver with the needle at 90 degrees again and 2/3 back. Using your forceps, evert and expose the site of entry for your needle, enter at 90 degrees, and exit just deep to the epidermis. Load your needle driver again, evert the opposite side, except this time we'll be going superficial to deep, and enter the skin just deep to the epidermis, exiting at the level where the first bite entered. Then tie with the two-handed tie or instrument tie. The running subcuticular suture is a high-yield but more complicated suturing technique. Ideally, the incision will be vertical to you, and we will be working from farthest to closest. First, start by creating an anchoring stitch by grabbing some dermis close to the apex, taking a bite, and tying the suture. You can then cut the short tail off, taking care not to cut the long tail. Now that our anchor is in place, reload your needle and take a bite at the apex, coming out just deep to the epidermis. We will continue to work along the dermal-epidermal junction, making sure to enter and exit at the same level so that the wound can approximate appropriately, and taking a slight step back on each bite when alternating sites. Once you approach the end, you want the two ends of the suture to come together out at the apex and closest to you. We now perform the Aberdeen knot, where you take a bite and avoid pulling the suture all the way through to form a loop. Place your thumb, pointer finger, and middle finger through the loop, using the pointer finger to sweep the free end through the loop and tighten. You will repeat that 3 to 4 times. Once you are ready to secure the Aberdeen knot, put the needle through the loop, then cinch down the knot by pulling the free end. The last step is to load the needle driver and bury the Aberdeen knot by entering just behind the apex, coming at 1 centimeter somewhere else, and cutting the suture at the skin.